Now we go ahead with dimensions of the labial surface. So on the labial surface, we have to measure the mesiodistal diameter. The mesiodistal diameter of mandibular central incisor of crown is 5 millimeters. So I will measure 5 millimeters on the crown, a little more than 5. I have measured 5.5 millimeters on the crown. This is the mesiodistal diameter. So this is the midline of the block. On either side of the midline, I will place the divider and just mark two points. So now you can see these 2 points. These are going, this is how much the tooth is going to be wide mesiodistally. I will just mark the outline of the tooth so that it becomes easier for me to carve. So now the tooth appears, this is how the tooth is going to be. Also the cervical dimension of the mandibular central incisor is 3.5 millimeters at the cervix. So I will measure 3.5 millimeters on the scale. 4 millimeters I have taken. I have kept 0.5 millimeters extra, and this is how much I put on the cervical line. So now you can see my drawing. This is the marking. This point indicates the cervical measurements of the crown 3.5 millimeters, and these two dots indicate the mesiodistal diameter of the crown, that is 5 millimeters. So 5 millimeters at the crown and 3.5 millimeters at the cervix. All the wax that is outside these lines is extra. So that is what I will be removing. So I will be removing all the wax extra. In maxillary central incisor, when we were carving more on the incisal edge and less in the cervical margin. But mandibular central incisor is the smallest tooth in the arch, and because it is the smallest tooth in the arch, more wax has to be removed at the cervical margin. So we will carve more on the cervical margin, less on the incisal edge here, because the cervical dimension is only 3.5 millimeters. So I am carving more on the cervical margin, extend the same carving onto the lingual aspect also. So now you can see the line that I had drawn. I have removed all the wax beyond that line. Same I will proceed for the other side. So this is the line of the crown that I have drawn. All the wax beyond the line I shall be removing. So I will be removing all the wax in the cervical area first, and then gradually extend to the incisal area. So I am keeping the reference line that I have drawn in mind and removing all the wax that is in excess. All the wax that is beyond the line, that is extra wax. So I will remove all of it. So I am removing the wax beyond the line that I have drawn, removing more on the cervical and less on the incisal aspect. Now you can notice that we have started seeing the shape of the tooth. So the tooth is roughly trapezoidal in its outline from the labial aspect, with two sides that are parallel and two non-parallel sides. So keeping this in mind, we have done most of the labial surface. Now we will move on to the lingual surface. Remember to give the lingual convergence. So you can see that right now this side is little straight and this is more convergent. We will convert both the sides into converging sides. For that, we will carve on the mesial and the distal aspect such that the lingual side should not be visible when viewed from the labial aspect. So when you look at the carving from the labial side, the lingual side should not be visible at all. This is called as lingual convergence.